Welcome to the By Design radio program. My name is Dr. James Proodian of Proodian Healthcare and ProodianHealthcare.com, where health literacy is the key to longevity. And as long as God has us on this side of eternity, my show is designed to help educate you and your families to feel better, function better, and live as many quality disease-free years as possible. Thanks for joining me this week as we take a look at a new subject matter. Many months ago, I've done some shows on women's health. And today and maybe next week, we're going to, I say maybe next week because I don't know if I'm going to get through all the information in one show. About 7 years ago, I was writing for a local newspaper. I practiced down in Long Branch, New Jersey, and I would publish a monthly column. And I did a two-part series on healthy mother, healthy child. And it was my wife and I had just had our fourth of five children, and wanted to write about some of the things that I observe in clinical practice, as well as being a dad and watching my wife go through pregnancies, that I thought was important to write about for women. So Luke 1:37, for with God nothing is impossible. My show, if you haven't heard me speak before, is all centered around looking at the design of the human body and what God has empowered us to be. He has given us a structure. He gave us the core components to live a healthy life, and the man influence on God's design has brought about a great deal of chronic illness. So when we look at gals and we look at the fact that men and women, many times in our news and in our readings, we talk about men and women being the same, and we are the same. For instance, the rights that we should have should be the same. We all have arms and legs, and we all have a heart and a head. We all have toes and fingers, but we aren't the same physiologically, meaning that God designed us to be very, very different people on the inside, and the incident rates of certain diseases are much more prevalent in women than they are in men, and vice versa. But the autoimmune diseases that I covered a few weeks ago, things like Graves' disease, impacts women 10 times to 1, women over men. Things like Hashimoto thyroiditis, which is an autoimmune disease, 7 to 1. 7 times more women than men get that condition. Multiple sclerosis is a 3 to 1 ratio. Rheumatoid arthritis is a 3 to 1 ratio. So for instance, we know that there are diseases that women are much more predisposed to than men are. And that's because of the way we're designed. And one of the things that women are designed to do that men are not is to have a baby. So if you haven't noticed that, let's get caught up on some basic human physiology, and the fact that we are different people with respect to how we process our food, how stress influences us. Stress will impact different hormones in me as a man and you and a woman. So there is a really cool study that I do in women's health. I do it when I do my public speaking, which compares different hormones and neurotransmitters and how stress and food influences those hormones and neurotransmitters, and it's different between a man and a woman. So let's dive into healthy mother, healthy child, and talk about the joys of pregnancy. Finding out that your wife is pregnant, finding out if you're a gal out there, that feeling of finding out that you're pregnant is certainly a blessing of a day. Although it comes with it, especially during that first pregnancy, with a myriad of questions. Which OBGYN am I going to use? Is it covered by insurance? How much time will I need to take off from work? Those are the types of things. I have to decorate the room. I got to paint. I have to nest. And it's really a very special time of life. I know when my wife and I went through it 5 times, it certainly was a very special time of life. And basically, when we look at pregnancy, we have to take a look at the fact that inside the womb, that baby is drawing a considerable amount of vitamins and minerals and other nutrients from the mom. So the baby's greatest nutritional needs occur between the 20th and 30th week of pregnancy. Now that woman's body is engaged basically in a very important task during pregnancy, which is establishing a supply of milk to feed her baby when the baby is born, right? So proper nutrition is critical, not only in the development of the baby in utero, but also in the development of that baby by nourishing the baby after the baby is born. And I think a lot of people forget about the fact that proper nutrition will aid in the development of milk supply. So that's a critical component as we find out that, our wives, our sisters, and such, our family members are becoming pregnant. And as husbands out there and as men out there, we want to make sure that they are nutrient dense, right? We really want to make sure that their bodies are well fed, and that gals, you guys take the time to really learn pre-pregnancy nutrition, okay? So even before you get pregnant, to start building a very strong warehouse of nutrients. So some of the essential nutrients during pregnancy, let's start with folic acid. This is also considered vitamin B9. It's a B vitamin. Maybe you've heard of it. Folic acid has been shown to prevent up to 70% of what's called neural tube defects. These are birth defects of the brain and the spine. So B vitamins are essential, but especially folic acid. And the amount of folic acid that you get is typically found in a prenatal vitamin. And the amount of folic acid, the reason why a prenatal is prescription is because they put a higher dosage of folic acid in the vitamin. I am a big fan of taking folic acid long before pregnancy, not just when you find out that you are pregnant. Some great sources of folic acid are romaine lettuce, asparagus, sunflower seeds. It's also folic acid is something that can be supplemented with, okay? The next one is iron. This is a vital nutrient, used during the formation of hemoglobin. And now hemoglobin is the substance in the red blood cell that actually carries the oxygen throughout our body. And oxygen is important, guys, okay? So the fact the woman's overall blood supply typically increases 30 to 35% during pregnancy, okay, and it's usually between the 12th and 20th week. So if we think about 1/3 of a woman's blood supply has to increase, there is a definite demand of increased iron. Now, normally, when we're not pregnant, about 15 to 18 milligrams of iron a day is what's recommended. That amount doubles when a woman gets pregnant, okay? So about 30 milligrams of iron is what's recommended, and iron can be constipating, so you really want to find the right type of iron. Many times the iron that they put in the prenatal is not the best form, so there are other types of iron that are not constipating and do, a very good job. The third one is calcium. Remember, we're building bones. We're building strong, durable bones and teeth, not just now, but calcium and other nutrients for bone development is a lifelong mission. But also calcium assists in the ability of blood to clot normally, all right? And it aids in the proper functioning of nerves and muscle fibers. So this helps our heart to beat normally. So calcium is an essential mineral, and it could be found in a number of things. Of green leafy vegetables is obviously always a place I go to for sources of just about everything. God gave us dark green leafy vegetables like kale and dandelion, and these are wonderful types of dark greens that are essential not just for pregnancy but for overall health. We should be consuming about 1,300 milligrams of good quality calcium a day. Broccoli is also a great source of calcium. Protein. Now, protein is something that a pregnant woman needs more of. The reason for it is in protein are things called amino acids, and amino acids are basically the building blocks. So they are building new body structure. Hey, we got a developing baby in utero. We have to build structure, right? So when that baby is born and it's 7, 8, 9 pounds, that baby has structure. Okay, it requires protein in order to build that, particularly in the second and third trimesters where a woman is gaining most of her weight. So the fetal growth, the baby growth, that baby in utero in the second and third trimester puts on most of its weight, and protein is very important. So our need for protein typically will double or so during pregnancy. Great sources of protein, they include things like beef and chicken and eggs, and there are some cheeses which I'll get into later about adding good essential protein to your diet. The next one up that I hope everyone understands is water, and I mean an abundance of water. While you're pregnant, it is critical that we are consuming at least 9 to 10 glasses of water a day. They prevent bladder infections, and bladder infections is something that you commonly see in pregnancy. So we want to make, especially if you have a history of bladder infections, and it also helps to relieve constipation, which once again is a common thing in pregnancy. So we want to drink plenty of water. And remember, guys, dehydration can actually cause contractions in some women in their third trimester. So we don't want early contractions coming because we're dehydrated. All right. So let's really focus on 8 to 10 glasses of water throughout our day. And remember, the fluid in a cup of coffee is not considered water, okay, because that's a diuretic, and caffeine should be avoided during pregnancy. So let's just keep that in mind, along with artificial colors and anything artificial, okay? The next up, because we're talking a little bit about, the process of when we're pregnant, diarrhea is a common thing. Fiber is critical. Water and fiber are two critical things to be consuming during pregnancy. Fruit and vegetables, you've heard me speak about the amount of fiber that are found in fruits and vegetables, and those are the types of fiber that we should be consuming throughout our day. I know grain and from bread gets all the attention with fiber, but remember, fruits and vegetables have far more fiber than grain and bread and cereals do, okay? Prenatal vitamins, we touched on a little bit. You really want to take a prenatal vitamin even before you get pregnant. And remember, that's looking at vitamin A, some vitamin D, of course, calcium. I always like a little extra vitamin C. I like the full complex of B vitamins, but like we talked about, folic acid is essential. And of course, iron, zinc, and vitamin E. These are the types of things that we want to make sure we're nourishing ourselves with because we have a growing baby inside of us. Now, cheese. I have a little bit of a problem with cheese. First of all, you should never consume unpasteurized cheese while you're pregnant, okay? So we do not want to go near unpasteurized anything while we're pregnant, as well as staying away from caffeine. These are two products that I really advise my pregnant gals to stay away from and to avoid altogether, especially caffeine. Caffeine is something that can lead to low birth weight and a couple of other things that certain studies link caffeine to. Also, fish. Not a big fan of shellfish at all during pregnancy. And if you're going to eat fish during pregnancy, please be careful where you get your fish from and avoid farm-raised fish altogether. We did shows on farm-raised fish. We did some work on this in the past. Just not a big fan of it. We're dealing with very polluted waters throughout our world right now. And during pregnancy, the last thing we want to be doing is consuming, for instance, bottom-feeding fish that have high mercury content, okay? So caffeine, unpasteurized cheese, or cheese in general, just if you're going to eat cheese, keep it very, very lean, not a whole lot of cheese, even though there is some calcium in cheese, and I get that. There's other sources of getting calcium. Finally, alcohol and tobacco. Hopefully, I am speaking to a group of people who understand that alcohol and tobacco, there is no such thing as a safe amount. It should never, ever be consumed during pregnancy, or even if you consider that you might be pregnant. Remember, guys, a lot of women, a lot of you gals out there, it takes 2 to 4 weeks post, actually getting pregnant, okay, before you find out. So there's that 2 to 4 week of that first trimester that many women don't even know that they're pregnant. So we want to avoid all of this type of toxic food in general, but especially if we're trying to get pregnant, praying for a pregnancy, and are thinking that we are pregnant. So as we look at women's health and as we look at pregnancy specifically, and the role that women, you're empowered to have, and the blessing and a God-given role, make your body stronger. Exercise is a wonderful thing during pregnancy. Now, moderate exercise, we want to make sure that we're not overdoing it, we're not doing any strength lifting, and as a sports chiropractor, I always advise my pregnant gals, second and third trimester, get off your feet. go into the side-lying position with your knees bent. It relieves the stress and pressure in your back. It allows blood to circulate. It allows the blood going into utero a little bit of a break. And feed yourself. Feed and drink water, okay? So these are some essential things. Healthy mother, healthy child. Yeah, it's not just about the baby, it's also about mommy. And if mommy wants to get back to quote unquote normal, I hear that all the time in practice. I want to be normal after I have my baby. Yes, the physical distortion that you go through during pregnancy and then doing the breastfeeding, it is being on a very solid dietary protocol, exercise protocol, and nourishing ourselves from the inside out, making sure that physiologically we're nourishing ourselves from the inside out is critical. And you guys, you have a role in this too. Shopping. Make the shopping list, gals. Give it to your husbands. Let's send them out to the good stores. Let them get involved in doing some of the shopping and nourishing, not only for you, but for themselves and for the baby. A family is a family. You should be eating together, spending time together, shopping for your foods together, and preparing the foods together. That's the way God designed us. And anybody who is out there pregnant listening to my show, God bless you and have a healthy, wonderful pregnancy. Thank you for listening to the By Design radio program and me, Dr. James Proodian. If you'd like any more information about me, please go to ProodianHealthcare.com and you could submit any questions, or you could subscribe to my blog, drproodian.com. I blog every Wednesday. God bless you and have a great week.